Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone, and thank you for being here. I'm Associate Professor Dr. Azizan binti Zainuddin from Faculty of Administrative Science and Policy Studies, Universiti Teknologi Malaysia Alam. Today, I'll be presenting our theme titled Tackling Child Nutrition Insecurity Towards Achieving Zero Hunger, a Qualitative Lens. So this presentation explores how a child malnutrition continues to affect rural communities in Malaysia, especially in Kuala Lumpur, Pahang, and how understanding parents' live experiences can help us to design more effective and context-sensitive policy to achieve SDG 2 Zero Hunger. So this is the contents of the presentation. We have the introduction, background of study, and then a problem statement, research objective, methodology, finding analysis, discussion, and also conclusion. So for the background of study, the child stunting and malnutrition remain both global and national concerns, directly aligning with Malaysia's commitment to Sustainable Development Goal 2, Zero Hunger. However, there is a growing concern over the persistence of these issues in rural areas where inequalities in access to nutritious food and healthcare continue to widen. For the problem statement, child malnutrition is still a serious problem in rural Malaysia, and communities like Kuala Lumpur and Pahang have limited access to healthy and nutritious food. Economic, structural, and policy barriers continue to cause nutrition insecurity. Although Malaysia has implemented NPA and M 1 until 3, the gap between urban and rural areas remains. Parents' experiences and coping strategies are still not well understood, and these challenges will slow Malaysia's progress toward SDG 2 Zero Hunger Target 2.2. This study aims to explore the causes of child nutrition insecurity from the perspective of affected guardians or parents. So this is the literature review. I summarize the key causes of child nutrition insecurity into three interconnected dimensions, which is social causes, economic causes, and also the environmental causes. We starting with the social causes. This relate to knowledge, culture, and also family conditions. For example, low parental education often leads to poor feeding and hygiene practices. Also, limited breastfeeding and feeding practices, as well as large family size and gender factors that contributed to poor child nutrition outcomes. Moving to economic causes, income plays a major role, and families with low and unstable income have limited ability to afford nutritious food. As a result, they often depend on cheap processed food, which increases the risk of both undernutrition and overweight, among children. Lastly, the environmental causes are linked to health and living conditions. Poor maternal nutrition before and during pregnancy, combined with unsafe water, poor sanitation, and limited nutrition awareness, further worsen the child nutrition insecurity. As we can see, these causes are interrelated. Social factors influence economic capability, while environmental challenges reinforce both. This interaction highlights the need for a multi-sectoral approach in addressing child nutrition insecurity. Next is a methodology part. So for this study, adopted a qualitative approach as the most as most previous research on child malnutrition has relied on quantitative methods. So by using this qualitative design, this study aimed to gain a deeper understanding of parents' life experiences and the social realities behind child nutrition insecurity. The research employed purposive sampling, involving seven informants, parents or guardians from Kampung Sungai Koyan 1, 2, and 3 in Kuala Lumpur, Pahang. These participants were selected because they have direct experience caring for children affected by nutrition challenges. For data collection, we conducted in-depth interviews guided by semi-structured questions, which allowed participants to freely share their thoughts and experiences while keeping discussion focused on key issues. All interviews were audio recorded with informed consent and transcribed verbatim to maintain data accuracy and ethical integrity. Finally, the data were analyzed using thematic analysis, following the six-phase framework by Braun and Clark, which involved familiarization, coding, team development, and interpretation to derive meaningful insights. Now we move to the findings and analysis. From the analysis, the four main themes emerged that explain the causes of child nutrition insecurity among families in Kuala Lumpur, Pahang. The first theme is attitude and behavior. Many mothers had low awareness of nutrition and practiced permissive feeding, often allowing children to eat instant noodles or snacks. For instance, one participant shared, if he doesn't eat, I just give him Maggie or snacks. This shows how limited nutritional knowledge influences daily feeding habits. The second theme is access to quality food. Families face limited variety, high food prices, and long travel distances to reach fresh markets. As one parent explained, we must go 40 kilometers to Kuala Lumpur to buy fruits. This reflects the rural challenge of physical and economic access to nutritious food. The third theme is financial constraint, which low income and large family size often force families to reduce food quality and quantity. One mother said, we cut chicken small so everyone can eat. This illustrates how poverty directly limits children nutrition. The fourth theme is education and awareness exposure, where parents with low education levels lack understanding of balanced diets and proper feeding practice. For example, one mother stated, both my husband and I only studied until standard 6. Many also had limited breastfeeding knowledge, as shown in the quote, I breastfed only 1 month, then changed to formula. Overall, the findings show that awareness, income, food access, and education interact to shape malnutrition in rural Malaysia. As for the discussion, this study shows that mothers' low awareness of nutrition, limited access to healthy food, and financial constraints are the major causes of child malnutrition in rural areas. Similar to Ahmad and Hui, 2021, many mothers in this study depended on low-cost processed food because of financial pressure. The result also aligned with Baharudin 2019 and Lemisa et al. 2023, who found that rural families struggle to buy fresh and nutritious food due to high prices and limited availability. In larger households, food variety and portion size are further reduced, consistent with Qbert 2017. Education and breastfeeding practices also play key roles. Mothers with lower education levels often lack knowledge of balanced diets and early feeding practices, similar to findings by Katak et al. 2017 and Pu et al. 2019. The short duration of breastfeeding and poor feeding habits in this study echo Asoba et al. 2019 and Campos et al. 2020. Overall, these findings support earlier work by Black et al. 2013 and Sharif et al. 2015, showing that poverty, education, and health behavior are interlinked factors influencing rural child nutrition. Hence, tackling this issue requires integrated social, economic, and educational strategies in line with SDG Target 2.20 hunger. As for the conclusion, this study directly supports SDG 2.0 hunger by identifying the social, economic, and environmental factors that contribute to child nutrition insecurity in rural areas of Kuala Lumpur, Pahang. It provides important evidence for policymakers to design targeted and practical nutrition policies that respond to real community challenges. By engaging grassroots stakeholders, this study encourages early intervention and community ownership in tackling child malnutrition. It also highlights the vital role of caregivers, particularly mothers, in shaping children's nutrition outcomes, aligning with the advocacy goals of UNICEF and the Gabungan Persatuan Wanita to empower women within households. Furthermore, the findings reveal implementation gaps in the National Plan of Action for Nutrition of Malaysia, suggesting the need for stronger policy alignment with community realities. Overall, this study offers a clear pathway to reduce child malnutrition and promote sustainable development in Malaysia, contributing meaningfully to achievement of SDG Target 2.2. With that, I thank you.